Hello, it's Dr. Rhonda Johnson. Today is Tuesday, June 1st, 2021. And today I'm going to be talking about the fact that millions are saying no to the COVID vaccines and what happens next. So we hear these terms post-pandemic mentioned frequently in conversation and on the news and on TV and social media. But the pandemic, folks, is still very much raging on. You know, every day, almost 1,000 people still die. The numbers may vary a little bit, may go down to 900, but still, people are still dying from COVID-19 here in the United States. And worldwide, nearly 3.6 million people have lost their lives to this virus. And that's a number that is surely an undercount. And I struggle with the fact that every new variant of concern, like the Indian, South African, Brazilian variants, seems to be worse than the original virus, meaning might infect more pregnant women or babies or younger people. It could be a more contagious virus. It could be a virus that's causing more severe respiratory symptoms. So, which brings me to this conversation about who's really at risk for COVID now. Well, the major high-risk populations for COVID are those who haven't been vaccinated and won't be vaccinated, and the unvaccinated people who refuse to wear their mask, and those people that continue to participate and high-risk activities with like-minded, similar-minded people. I still do a lot of community education, and I have had countless people tell me that they refuse the COVID vaccines for various reasons, and they usually go like this. Well, it's my personal right, or it's my right to live or die. It's my body, my right. Some people tell me, I trust that my immune system will protect me. Others say, when it's my time to go, I go. Other people say, I know the coronavirus is real, but I believe the data is exaggerated. Some people say, well, I don't want to take the vaccines because they're not even FDA approved. They're still emergency use vaccines. And other people say, well, I don't want to take this vaccine because if something goes wrong with me, I can't sue the government. Those are the common explanations that I hear, folks. But meanwhile, a shift is taking place. In countries that have a high vaccination response, the number of people with new COVID infections are falling, and the majority of COVID infections now are occurring in unvaccinated people. And why is that? Because the virus doesn't do well in people who are vaccinated. The virus thrives in people who aren't immune to it. And just remember what the vaccines do. They give you immunity to this virus. So as I read different articles, I'm starting to see things that I wanted to mention. People are writing about this, that COVID may become a sickness of choice. A sickness of choice. And people may blame people who get COVID because of the following reasons. And this is what I've heard. That people are going to get COVID because they are victims of their own stupidity. That they should have accepted the vaccine. That they should have protected themselves and others. This is what I've heard already. And we're only at a point where 47% of U.S. adults are vaccinated. And we're starting to see these type of comments. Now this week, in the past week, we've seen several large employers that are in healthcare systems move quickly to mandate vaccines. A large health system in New Jersey and in Pennsylvania, the University of Pennsylvania, they have 6 hospitals, and they have announced that they're going to make the COVID-19 vaccine mandatory for all employees and clinical staff no later than September 1st. and new hires must show proof of COVID vaccine before beginning work. So, of course, they have to offer the exceptions for the disabled and religious exemptions. But what I'm concerned about is the COVID-19 equity issues will even become greater as the divide between who's vaccinated and who's unvaccinated grows. We know that it's a fact that people who are poor, black, and brown have suffered disproportionately from COVID, as they suffer disproportionately from all chronic diseases. And I'm beginning to wonder if COVID then is going to be a sickness of poor people, or in some cases, religious groups or communities of color, because we're seeing a lot of disparities among who is vaccinated and who isn't vaccinated. For example, poor people are less likely to be vaccinated. African American men are less likely to be vaccinated. Men in general are less likely to be vaccinated. Republican men are less likely to be vaccinated. We could see a situation where certain demographic groups and communities are going to be continuously vulnerable to COVID because of vaccine refusal. Then what, folks? Then what? That's the big question. It's going to be challenging because, again, so many people continue to believe these conspiracy theories, and I'll call it fake news. And these beliefs are preventing people from living their lives to their fullest potential in the face of this pandemic. So what are we to do? We are to just keep going forward, keep continuing to spread the truth and facts, not fear, about this vaccine. This is my message today. This is Dr. Rhonda Johnson. As always, my views are my own. Stay safe, folks, and have a blessed day.